I am Aslonova Makhliyo, teacher at Department of Obstetrics Gynecology, Bukhara Medical State University, after named Abu Ali ibn Sina. Today's topic name is preterm labor or preterm birth. Preterm labor, what is it? Preterm labor or birth? It's preterm birth refers to birth of an infant at until 37 weeks. Preterm birth classification, it's three classification: moderate, very preterm birth, and extremely preterm birth. Moderate late preterm birth, it's 32 until 37 weeks. Very preterm birth, it's 28 until 32 weeks. Extremely preterm birth, it's before 28 weeks. Its incidence of preterm birth, it's most commonly reasons is spontaneous 45%, it's premature rupture of membranes. Others, iatrogenic at maternal termination of pregnancy and severe preeclampsia 30-35%. Reasons for preterm labor or preterm birth, it's fetal or maternal stress, infections of uterus or cervix, and decidual hemorrhage and uterine overdistensions. It's fetal or maternal stress, it's definition disease, some chronic disease like anemia, kidney disease, and preeclampsia. In maternal stress, it increases placental hormones, corticosteroid hormone, and premature activation of fetal hypothalamus, pituitary, adrenal axis, and increases fetal cortisol production, leads to withdrawal of progesterone. And fetal stress this is some uteroplacental insufficiency and intrauterine growth restriction and congenital anomalies. Some reasons it's maybe infections. Infections is asymptomatic bacteriuria, chorion amnionitis, and bacterial vaginosis, COVID infection, periodontal infections, and group B streptococcus. Some infections, ascending infection, reach the uterus and fetus. Decidual hemorrhage. It's decidual hemorrhage may be abruptia placenta, also placenta previa. It's placenta previa. And history of vaginal bleeding. It's hemorrhage, release, and thrombin increase uterine. And after this, uterine contractility release and metalloproteinases decrease and membranous premature function. And after this, progesterone decrease and labor. And uterine overdestination, uterine overdestination, it's multifetal pregnancy or polyhydramnios and fibroids of uterus. In consequences of prematurity, it's respiratory distress syndrome, necrotizing enterocolitis, and intracranial hemorrhage, hypoglycemia, and infections, retinopathy of premature males, cryptarchism, and females, unfused labia, and low birth rate. Prediction of preterm labor. What prediction? It's every pregnant female must undergo transvaginal scan during 16 and 24 weeks. Its cervical length in normal more than 3 cm if you were doing some transvaginal scan. If cervical length more than 3 cm, predict preterm labor. If cervical length less 2 cm, it's diagnostic of preterm labor. It's short cervix, but it's normal cervix. Prevention of preterm labor, it's first it's cervical cerclage, and after this progesterone therapy and cessation of smoking. How to approach? One most common reason for preterm labor is abruption placenta, and patients may have concealed hemorrhage. On heart examination may be low and high heart rate. On per-abdominal examination, check for uterine constructions, tone of uterus, position, lie, and presentation. Fetal heart sounds, and don't jump to per-vaginal examination. First, rule out PROM as it may cause some infections. On per speculum examination, rule out PROM and check for any bleeding or placenta previa and dilation of cervix. Effects of preterm labor: it's premature of lungs if delivered before 37 weeks, and cerebral palsy if delivered before 32 weeks. Approach to lung maturity: it's we use also corticosteroids are given in all the preterm births which are done before 37 weeks, and corticosteroid used are dexamethasone. It's 6 mg each 12 hourly, or betamethasone. It's 12 mg each in 24 hours. Corticosteroids are contraindicated in chorion amnionitis. We don't use. Also, we use tocolytics are given to increase the time of activity of corticosteroids, as corticosteroids take 48 hours of time. And we use also tocolytics. It's nifedipine 10 mg, and we use. Indications for active management of preterm labor: absence of fetal bladder, the presence of regular labor activity, presence of signs of infections, intrauterine suffering of the fetus, severe somatic disease of the mother, and complications associated with pregnancy and not amenable to treatment. Suspicions of deformity or anomalies in the development of the fetus. Management of preterm labor in the first stage of labor: it's labor stimulation, it's need, and prevention of fetal hypoxia, antispasmodics. And first, the management of preterm labor in the second stage of labor is dissection of perineum. It's pudendal anesthesia, maybe if needed, irrigation of the skin of the perineum with the aerosol of lidocaine, and in the introductions of muscle relaxant of the central action for methadol if you need. But it started premature birth, it's time of labor, and a child born premature has signs of immaturity. Maybe its body weighs less than 205 grams and length less than 45 centimeters, lot of cheese loop and insufficient development of the subcutaneous fat layer and fluff on the body, soft cartilages of the nose and auricle, and nails don't go beyond the fingertips, and the umbilical ring is located closer to the womb, and in boys the testicles are not lowered into the scrotum. In girls the labia minor are not covered by the large ones. Evaluation of the degree of maturity is carried out on the special scale. The assessment of the state is carried out on the Silverman scale. It's fetal hypertrophy. It's like to fetal some full-term infant, like hypotrophic. It's preterm birth. And management of preterm labor: it's until 34 weeks and more than 32 weeks. In both cases, admit patients, observe for 2-4 hours, see for any dilation of cervix, start antibiotics prophylaxis for rupture membranes, do culture test, if positive continues. and corticosteroids to accelerate lung maturity, and tocolytics if more than 34 weeks and until 32 weeks. In established preterm case, no rule of progesterone in induction of labor. All these patients should be monitored for 6 hours, and if contractility is absent and no dilation, can send home access fetal membranes and rule out abruptio and fetal distress in all preterm labors. Prevention of preterm birth, it's in the antenatal clinic, introduce careful monitoring of pregnant women from high-risk groups in critical terms, hospitalize and carry out pathogenetic treatment. Thank you.